Alright guys, so in this first video, we're going to break down how to study for pharmacology. I'm going to teach you how to break down each drug into different segments. That way we can memorize them easily and we can do well on our tests. So let's get started. So the first thing you're going to want to know when you're studying for pharmacology and really studying for anything is how are you going to actually study? What are you studying? Best thing to do, you can do flashcards, write the drug name on top, put the considerations, the indications, contraindications, mechanism of actions on the back of the card, flip them over back and forth. One thing that I personally did when I was in nursing school was I typed out a study guide. And I typed it out and typed it out and typed it out, and I even wrote it out sometimes. And the act of actually typing it or writing it allowed me to memorize everything. So that way, when I close my eyes, I can picture the study guide in my brain. So if I knew that I had a question about a drug, I can close my eyes, picture where that drug was on the study guide, and see what I wrote. And it was very repetitive. I might have wrote a study guide, 5-page study guides, 10 times, before an exam to memorize exactly what was on that study guide. And for me, that was the best thing. I also did flashcards. Flashcards can get cumbersome. You turn up to have thousands of flashcards by the end of nursing school. With the computer and typing it out, at least it's on a Word document, you're not bombarded by pieces of paper. But both equally work as well. It just depends how you study. When you're first breaking down a drug, the first thing you want to know is the drug class. Most drug classes have the same endings all the time. So let's take, for example, beta blockers. Beta blockers end in LOL. Mostly all beta blockers are going to end in LOL. So if you see LOL and you don't know what the hell the other drug is, it's probably a beta blocker. Same thing with calcium channel blockers. They're going to end in INE. If you see a drug ending in INE, it's a calcium channel blocker. Penicillin is another one. Penicillin is going to end with cillin, C-I-L-L-I-N. If it has C-I-L-L-I-N, it's a penicillin, it's an antibiotic. You can move forward from that. The next part, you're going to want to know the names of the drugs. Now, in nursing school, there's hundreds of drugs that you need to know. For your test, you probably just need to know the top 3. The top 3 drugs in each class that we use in the hospital. Now, there's 2 different names that each drug's kind of use. There's a brand name or a trade name, and there's also the generic name. You're going to want to know both of these names for the top 3 drugs for each class. For example, a generic name of acetaminophen. We all know that the brand name or trade name of that is Tylenol. If a question asks you a patient is on Tylenol or a patient is on acetaminophen, you're going to want to know that that's the same drug, okay? Now the next part, after you know the names and memorize the top 3 names of drugs that we use, the trade and the generic, you're going to want to know the MOA or the mechanism of action. Okay, don't have to go into the cellular part of this in nursing school, but you're going to want to know at least what organ it targets. So if you're talking about blood pressure medications, you want to know the name of the blood pressure medication, and you want to know that it controls blood pressure. If you're talking about a diuretic, you want to know that the diuretics work in the kidneys. Okay, so if you have a question about a diuretic and all the answers are not about the kidneys, the answer about the kidneys is probably the right answer. So this will help you when answering questions by knowing the target organ of the drug. If you know the drug and you know the organ, you're probably going to get the right answer. The next is indications and contraindications. Now, as well, you're going to want to know the top 3 indications, top 3 contraindications. Okay, patient is taking oxycodone. We know oxycodone is a narcotic. Patient seen at bedside by nurse, patient is drowsy and sedated. Okay, what's a contraindication to a narcotic? Drowsy and sedation. So the first thing you're going to look for is to not give that medication or contact the healthcare provider for further instruction, as opposed to give the medication or do nothing, whatever the question's asking. So this is going to guide you in how to answer different questions. The next part is side effects. You're going to want to know some of the side effects of these medications. And like I said, top 3. This is all that's required for you in nursing school. Know the top 3, okay? So the side effects, of an antibiotic. The first one is allergy. Boom, done, allergy. Know the next top 2 for each antibiotic and you'll be golden. The next part is nursing considerations. This part is specifically for nurses. If you go to a patient's bedside and you're administering a stool softener like Colace or something like that, and the patient's having diarrhea, guess what? You're not going to give that medication. But if you don't know what Colace is, how the hell are you going to know? So those are some nursing considerations that you're going to have to know, but it's important that you know the actual drug name of that. And like I said, top 3, know the top 3 nursing considerations. Now, these are going to have overlap, indications, contraindications, side effects, nursing indications. They're all going to overlap, and most of them are going to be the same. So a contraindication for one drug is going to be a nursing consideration for that same drug. All right, so don't get discouraged when you're studying for pharmacology. Follow these steps, know the top 3 for everything. And this is going to be the first video of this whole segment, and we're going to go through all the drug classes, the drug names, and we're going to help you out. All right, so stay tuned. Thank you guys so much for watching. Really appreciate it. If you liked the video, please like and subscribe so you don't miss any weekly video updates, and we'll see you next time.